Have you ever wondered about dry needling? It's a technique that we use on occasion at HealthQuest and the OAI. Today we're going to show you how we integrate it into our treatment. Hey guys, Chris, DPT, OMPT with the OAI and HealthQuest. Here we got Max here. We're going to go through a standard treatment that we would incorporate dry needling through. So we're going to focus on pronation and internal rotation deficit that you see a lot in our overhead athletes. We would have Max first warm up on one of the arm bike or the pulleys or something just to get the tissues working. We would then follow that up with joint mobs, maybe some functional massage, some muscle work. So for pronation, focus on the posterior side of his forearm. Work on supinator, some of the extensors. So we can do that with bone movement, like I'm moving the wrist to lengthen the tissues in the area. Dummy thumb. I got the thumb going cross friction over the tissues.
I will actually can be here Monday. If it all depends on Monday. If you're cool with doing Wednesday, Saturday. Yeah, Wednesday, Saturday.
And we will follow that up with some work up in the shoulder for internal rotation, up in the infraspinatus, the muscle belly, working over the insertion.
I mean, so what we were thinking about was, so if you're the only
Following that hands-on treatment, we would then incorporate the dry needling, like a trigger point release, to help improve pain, to improve mobility, improve soft tissue mobility, improve joint mobility, to stimulate blood flow and healing to the area. So we want to prep it first. Of course, always following the precautions, alcohol swab. Because we're using the needle, we're going through the skin. We want to make sure that he has no precautions involved with the needling, such as being on blood thinner.
making it, and then the other thing is that since he's never in the clinic anymore, now that I'm in this position, I'm only going to be in the clinic.
Use a glove on my left hand, right-handed. So when we do this, we're going to palpate with our hands, and then we're going to palpate with the needle. We want to find the trigger point, and then we're going to leave it in there for 10 to 15 minutes to get an effect. So we found that, leaving it in has more of an effect than just oscillating it, and 15 minutes past that, you don't really get much of an effect, more than you get with the 15 minutes. So the major thing you want to know is just know your anatomy, know where all the tissues are, know where the nerves, the arteries run. So we palpate, find the trigger point.
So then we're going to take our feet, we're going to put it right on the dumbbell. Okay, we're going to bring it up and out.
We palpate with our hand. Now we're palpating with the needle. When we find a treatment zone, you'll feel a restriction. Maybe you'll get a muscle twitch in that area. Give it a little rotation to wrap the fascia around the needle. And then we would kind of surround that whole area like so.
So again, lean back, don't bend.
Doing okay, Max? Yep. Patient should feel maybe a dull ache in the area, like a muscle twitch like I mentioned. Maybe a little bit of paresthesia. That's about it. So it's to surround the area.
Yeah, I feel it in the lower back. Good. And that's where, yeah. Tightening or pain? Not pain. Okay.
That we want to treat.
Working. Okay.
We'll do a few up in the shoulder.
And then I thought I'd feel it more in my abs.
Shoulder's a little trickier because you have the rib cage, right? You want to always be aware of the ribs and the lungs. We're going to be on the shoulder blade, so that's not an issue. Again, if you know your anatomy. So for infraspinatus, we palpate. A lot of tension usually happens here in the posterior deltoid, where the infra wraps around onto the tubercle. Put it in a tangential angle, just to be aware of.
I was thinking of the,
area.
yeah. I really like those designs.
We follow that. It's the shoulder blade.
There when we get there. Do those all day.
So for this one, because we're getting closer, I'm going to go away from the lungs.
Easy.
Got some thick tissue there, Max. There we go. A little palpation. There it is. One twist and that should tighten up right away. That's how you know you're in the treatment zone. So if I'm treating him on his side, I would do everything on his side. If he was on his back, I would do everything on his back. If he was on his stomach, everything on his stomach. Get to the areas that I need to get to, no matter the position. You know, it's not uncommon to have, 10, 15 needles at one time. There's a little twitch. And we'll just put one in. It's wherever I find
It hurts right now?
the restriction, right there. This can also be used to help stimulate blood flow healing to, let's say, UCL reconstruction along the scar. I wouldn't do that until 10 to 12 weeks following, however. There you go. So we leave that in again 10 to 15 minutes. Maybe follow that up with some modality, some heat or some ice, and then we would go into our normal routine with our rotator cuff strengthening, some overhead dynamic strengthening, and then into our phase-specific throwing program for our overhead athletes.